Hello everybody, welcome to day 51 of my recovery from skin removal surgery, arm lift, and reverse tummy tuck. And I'm going to take you through my routine of how I undress my wounds. I'm going to take my shower, which I haven't taken in 3 days, a full shower. And then I'm going to show you my routine of putting everything back on, just to show you what the day-to-day is like and what has worked best treatment-wise for helping me close these wounds. But first, we get to see how we're doing. And I've got a couple little open ones over on this side, and then I've got the major ones over on this side, and 51 days in, I'm hoping that there is improvement. So let's try this one first. You can see that this is a Mepilex AG pad. It's silver and it sticks directly onto your wound. This is super helpful. They're very expensive, but they're really great, especially for wounds like this, because everywhere it touches is silver. It's very absorbent. You can see that it kind of went all the way through here. So it keeps the wound clean. It keeps it from damaging the tissue around it. So let's see what this looks like underneath here. I also have an adhesive removing spray, which I would recommend because you don't want to damage the wound as it comes off. So if it starts sticking, which this one is a little bit, you can just spray that down in there. Don't breathe it in. It'll come right off a lot easier without damaging the wound or the skin. And you can see that it really just kind of goes into this thing. And these are super handy. And this is what the wound looks like right now. And you can see that it started bleeding a little bit. That's actually a good sign. That means it's healthy blood flow. And you can just grab a gauze and dab that, it'll stop. And that's good. That's actually really good, healthy looking, and hopefully getting closer to closing up. Now let's look at the other one. Just gonna keep that here for a minute. All right, here we go. I'm excited. This is what I'm waiting on. Waiting very impatiently, or patiently. I'm waiting patiently, I guess. All right, we'll get some of the spray. And there, look, it came right off without problem at all. And as you can see, these are getting more shallow. They're even less red this time. No blood. And that is how I am looking on day 51 with my openings. These didn't open up until maybe 20 days in. This is what the pad looks like. So you see all that gunky gunk in there. And what I love about these pads is it doesn't sit on the top. It doesn't really sit on the wound or on your skin. It goes directly into the pad. Keeps it very clean, and the silver acts as antimicrobial, which keeps it from getting infected. And luckily I have not had any infection in quite some time, and the healing continues. So this is what we're looking like on day 51. And yeah, it looks good. It looks like it's healing good. These are getting to be more superficial than anything. I feel like my movement's not really that encumbered anymore. As you can see, I can still do these things and it doesn't really rip it open or anything. So that is very helpful. All right, now I'm gonna get into the shower. You wanna come? No, I can't get this camera wet. Yeah, I'm gonna go take a shower. My favorite time of the 3 days. It used to be my favorite time of the day, but now it's my favorite time of the 3 days. And then I'm going to show you how I redress this and put compression on it, and basically just the normal routine that I do in recovering from skin removal surgery. Now, if you do have an arm lift, know that this probably isn't going to be what happens to you. Now, openings underneath your armpit are very common when it comes to these because of the tension. The shoulder and the rotation, the degrees that it rotates is more than any other part of your body. But please remember that I did weigh 300 pounds more than I do now, and my skin elasticity is gone. The skin is very thin. Dr. Kababe told me even before the surgery my skin was very poor quality, very thin, and the sutures itself barely held these together. So, they might open up. If you do have openings, I'm going to show you exactly what to do. So, let's go. All right, we're fresh out of the hottest shower that's ever existed. Here's how the wounds are looking, nice and clean. And I am going to start with my right arm, and I'm going to use this Mepilex AG. And this is one of my favorite things ever. I didn't know this existed until recently. And this just sticks right on the wound. It's all silver, so it's actually amazing. And this is just big enough to cover this area right here. So that is where we're going to start. Now, before I do it, I like to get some Vaj, and I dab the wounds. Make sure that it's nice and clean. And then I take some of this, which has got zinc oxide. Desitin will also work. I put it around the healthy skin so that none of that skin gets damaged by anything that oozes. Although with this, It's not much of a issue because that stuff really absorbs. But just in case, I'll put it around there to keep the healthy tissue healthy. Alright, and now we're ready for the dressing. And this is super simple. The next one I'm going to do is going to be a little bit more difficult, but this one's super simple. You just take it off, you line it up, and it's very sticky. So here's the part that goes on you. Line it up to the wounds, and I want it to cover all the way from here to here. So I get it nice and lined up, and then just apply. Alright, and then make sure it's stuck. Move your arm, hold it in place while you move your arm around the way it's going to be moving, so that everything sticks, and then that's it for that one. And now this one's a little bit trickier because it's so long that I'm cutting an aquacell piece that is this long. This is my aquacell piece. This is silver nitrate, and my Mepilex borders aren't exactly that big. So this is a non-silver Mepilex. Now, I guess it would be. So what I'm going to do now is the same thing with the Vaj. I'm going to apply it to the wound bed, let it dry. Got my sterile Q-tips over here. And then we're going to make sure that we get all of that covered. Alright, and then on the same as the other one. And this one's a little bit more likely to cause some irritation around the wound, so we're going to be sure. And it's kind of hard when you can't see. But we want to keep this healthy tissue healthy. Now I might have put too much there. So we can just take it off. And as far as this, I'm going to have to use the camera. But we just go around there a little bit. You know, you don't got to see it. It's not got to be perfect. That is good enough. And so I take the Aquacell AG and I secure exactly where it's going to go. Just down here. I get the Mepilex border. Unstickify it. Or actually stickify it. And then I'm going to put that directly over here. Make sure that that is very secure on here. I'm going to do the same thing I did before, which is move it around while holding it in place every which way I'm going to go. And then like that. Alright, so now we're good, dressed, and all I have left to do is put on my compression, which will hold all of this in place even better. If only I knew where I took the compression off, I would be able to find it. This compression is an arm-only compression that sits down here, so it doesn't interrupt my armpit wounds. So if you are looking for compression and you're having the arm lift, I really recommend this. This is lipoelastic synthesis to me. I'm now working with them actually. I like this so much. Whatever compression you use, it's important to have. Unfortunately, I'm in week 6 and still having to wear the compression. Me and Dr. Kababe made a deal, but having it like this, it really isn't that bad because I'm not really wearing that much. It's not like a full body. I mean, you can get the full body, but I prefer not to. So to put this on, what I do is I go ahead and pull it up over my arm, and I want to get it over this first gauze first, so that's going to keep it in place. I don't want it to bunch up or anything, so I make sure that this is all the way there. I make sure everything's still exactly where it needs to be, and make sure it's tucked. There we go. Now that's nice and secure. Alright, so I'm going to try to keep this up straight, and then I just reach behind me right here. Let me scoot back. While keeping this one going, you can't, this is helpful if you have someone else to help you, but you don't have to. Like, you can just do it like this, and then you just reach in with this one. Make sure you pull this up. Yeah, and then do the same thing over here where you kind of make sure that this is staying tucked in. You want to pull it. Make sure that it's got you. And that's good right there. Check this again. We're still good over here. Got the armpit thing in place, which is very helpful. It's a little padding right there. And then all you got to do is clip these up, pull this down so that it's not anywhere near your armpit. There we go. Did you hear that flip in the back there? And you can do it even without help. And now I am good for the next 3 days now. So I've got the silver on me. I am hoping that next time I look at these wounds, they're going to be even better. I was comparing the biggest wound to my last picture I took 4 days ago, and there was significant narrowing of the wound, which was very exciting to me because it's the first time I've seen my wounds actually move towards closing. They seem to be opening more and more, which is a natural process of healing when you have thin skin like I do, very poor elasticity because I lost 300 pounds. So my arms carried a lot of weight. It was super stretched. Dr. Kakababe said even the sutures themselves were barely holding it together. So this was kind of expected. It's an unfortunate part of having lost so much weight, but well worth it. And now I'm good for the next 3 days. Thanks for coming along. I appreciate it. Thank you all for your love and support, and I'll talk to you soon.